In a country as diverse and culturally rich as India, the stigma surrounding mental health continues to be a significant barrier to seeking treatment and support. The societal perception of mental health issues often leads to discrimination, isolation, and a lack of understanding among the general population. Despite efforts to raise awareness, the deeply ingrained stigma persists, preventing many individuals from seeking the help they need. Historically, mental health has been a taboo subject in India, with conversations around it being considered a sign of weakness or shame. This mindset can be traced back to traditional beliefs and cultural norms that view mental illness as a form of personal failure rather than a medical condition. Families may feel embarrassed or fearful of judgment from their communities, leading them to keep mental health issues hidden and untreated. One specific example of the stigma surrounding mental health in India can be seen in the prevalence of misconceptions and superstitions related to mental illness. For instance, some communities believe that mental health problems are a result of curses or supernatural forces, leading individuals to seek remedies from spiritual healers rather than trained professionals. These beliefs perpetuate the idea that mental health issues are not legitimate medical concerns, further marginalizing those in need of support. Another contributing factor to the stigma is the portrayal of mental health in popular media and entertainment. Often depicted inaccurately or sensationalized, representations of mental illness in films and television shows can reinforce negative stereotypes and misconceptions. This misrepresentation not only perpetuates stigma but also hinders efforts to educate the public and promote understanding. Moreover, the lack of open discussions and education about mental health in schools and communities exacerbates the stigma. Without proper awareness and information, individuals may struggle to recognize symptoms of mental illness in themselves or others, leading to delays in seeking treatment. The absence of mental health education perpetuates myths and misconceptions, further entrenching the stigma within society. Despite these challenges, there have been efforts to address the stigma surrounding mental health in India. Organizations and advocacy groups have been working to promote awareness, challenge stereotypes, and provide support to those affected by mental health issues. By sharing personal stories, organizing events, and engaging with policymakers, these initiatives aim to break down barriers and encourage open conversations about mental health. However, the road to destigmatizing mental health in India is long and complex. It requires a multifaceted approach that involves changing societal attitudes, improving access to mental health services, and fostering a culture of empathy and understanding. By addressing the root causes of stigma and promoting acceptance and support, India can work towards creating a more inclusive and compassionate society for individuals dealing with mental health challenges. In India, the lack of access to mental health care services remains a critical issue, hindering the well-being of millions of individuals. Despite growing awareness about mental health, the gap between those in need of support and those who can access it continues to widen due to various systemic challenges. One significant factor contributing to the lack of access is the severe shortage of mental health professionals in the country. According to a report by the World Health Organization, India faces a significant scarcity of mental health professionals with only 0.3 psychiatrists, 0.07 psychologists, and 0.07 social workers available per 100,000 people. This shortage severely limits the availability of mental health services, particularly in rural areas where the majority of the population resides. Furthermore, the uneven distribution of mental health facilities exacerbates the accessibility issue. While urban areas may have relatively better access to mental health care services, rural regions often lack even basic mental health infrastructure. This urban-rural disparity leaves a large segment of the population without proper support, forcing many individuals to travel long distances to seek help, which can be both physically and financially burdensome. In addition to the scarcity of mental health professionals and facilities, the stigma associated with seeking mental health care plays a significant role in deterring individuals from accessing services. In Indian society, mental health issues are often stigmatized, leading many to suffer in silence rather than seek help. This stigma creates a barrier to seeking timely and effective treatment, further perpetuating the cycle of limited access to mental health care services. Moreover, the affordability of mental health care services poses a significant challenge for many Indians. The cost of mental health treatment coupled with a lack of insurance coverage for mental health conditions makes it financially unfeasible for a large portion of the population to seek professional help. As a result, individuals are left to cope with their mental health issues without proper intervention, leading to potential worsening of symptoms and overall well-being. Despite efforts to improve mental health care accessibility in India, such as the implementation of the Mental Health Care Act in 2017,
significant gaps persist. The Act aimed to provide mental health services to all individuals and decriminalize suicide attempts, but effective implementation and awareness of these rights remain limited in many parts of the country. In conclusion, the lack of access to mental health care services in India is a multifaceted issue rooted in systemic challenges, including the shortage of professionals, uneven distribution of facilities, stigma, and affordability concerns. Addressing these barriers is crucial to ensure that all individuals have the opportunity to receive the mental health support they need for a healthier and more fulfilling life. Cultural factors impacting mental health treatment. When it comes to mental health treatment in India, cultural factors play a significant role in shaping beliefs, attitudes, and approaches towards mental illnesses. The cultural context of India is rich and diverse, with various traditions, beliefs, and practices that influence how mental health issues are perceived and addressed within the society. One of the key cultural factors impacting mental health treatment in India is the strong emphasis on family and community. In Indian culture, family is considered the cornerstone of support, and individuals often rely on their family members for emotional and psychological well-being. While this familial support can be beneficial, it can also lead to challenges in seeking professional mental health treatment. There is a stigma attached to mental illness in many Indian communities, with individuals often fearing social ostracization or judgment from their communities, leading them to keep mental health issues hidden and untreated. Moreover, the cultural norms around mental health in India often intersect with gender roles and expectations. Women, in particular, may face additional barriers in accessing mental health care due to traditional gender norms that dictate their roles and responsibilities within the family. This can result in women neglecting their mental health needs or facing resistance when seeking professional help. Religion and spirituality also play a crucial role in shaping attitudes towards mental health in India. Many Indians turn to religious leaders, temples, or spiritual practices for solace and healing during times of mental distress. While spiritual guidance can provide comfort to some individuals, it may not always address the underlying psychological issues that require professional intervention. Furthermore, the cultural diversity within India means that different regions and communities have unique beliefs and practices related to mental health. For example, Ayurveda, an ancient system of medicine, is deeply rooted in Indian culture and offers alternative approaches to treating mental health conditions. Traditional healers such as Ayurvedic practitioners and spiritual gurus continue to hold sway in certain communities, providing alternative avenues for mental health support. In recent years, there has been a growing recognition of the need to integrate cultural competence into mental health care services in India. Mental health professionals are increasingly being trained to understand and respect the cultural nuances that influence their clients' perceptions of mental illness. Efforts are being made to bridge the gap between Western psychiatric practices and indigenous healing methods to provide holistic and culturally sensitive care to individuals in need. In conclusion, the cultural factors impacting mental health treatment in India are complex and deeply ingrained in societal norms and traditions. By acknowledging and addressing these cultural nuances, mental health professionals can enhance the effectiveness of their interventions and ensure that individuals from diverse backgrounds receive the support and care they deserve. In recent years, the Indian government has taken significant steps towards addressing mental health concerns within the country. While there are still many challenges to overcome, the implementation of various initiatives and policies showcases a growing recognition of the importance of mental well-being. One notable initiative is the National Mental Health Program (NMHP), launched in 1982, aiming to provide accessible, affordable, and quality mental health care services to all individuals. Through this program, the government has established district-level mental health clinics and trained healthcare professionals to better address mental health issues across communities. This initiative has played a crucial role in increasing awareness and reducing the stigma associated with seeking mental health support. Another key development is the Mental Healthcare Act of 2017, which decriminalized suicide attempts and mandated access to mental health services for all citizens. This legislation represents a significant shift towards prioritizing mental health within the legal framework and ensuring that individuals struggling with mental health issues receive the necessary support and treatment without fear of legal repercussions. Furthermore, the government has also collaborated with various non-governmental organizations and international agencies to enhance mental health services and promote awareness. These partnerships have led to the implementation of innovative programs such as telepsychiatry services and community outreach initiatives to reach underserved populations and provide mental health support in remote areas. One of the most successful government-led mental health initiatives is the District Mental Health Program (DMHP) in Tamil Nadu, which has effectively integrated mental health services into primary healthcare systems. By training primary care physicians and community health workers in identifying and managing mental health conditions, the DMHP has improved access to care for individuals in rural and urban areas alike. Despite these positive steps, challenges such as limited funding, inadequate infrastructure, and the shortage of mental health professionals continue to pose obstacles to comprehensive mental health care delivery. The need for sustained efforts and increased investment in mental health services remain paramount to address the growing burden of mental health disorders in India. Transitioning from policy initiatives to effective implementation on the ground is crucial to ensure that individuals in need receive the support they require. By fostering collaboration between government agencies, healthcare providers, and community stakeholders, India can make significant progress in promoting mental health awareness and resilience across the population. The evolving landscape of mental health policies in India signals a promising shift towards prioritizing mental well-being and creating a more inclusive and compassionate society for individuals dealing with mental health challenges. Traditional healers and alternative therapies have long played a significant role in addressing mental health concerns